Hi, I hope you guys are well. This is Satyam, and today we're gonna talk about the anatomy of the diaphragm. So let's start with the definition. So the diaphragm is a dome-shaped muscle that separates the thoracic cavity from the abdominal cavity. And here you can see the dome shape. And the diaphragm only loses its dome shape during respiration. Now, moving on. Here is a picture of the diaphragm, and let's begin to label it. So first, I would start with the attachments of the diaphragm. So let's start with the anterior attachment. So the diaphragm anteriorly is attached to a part of the sternum called the xiphoid process. Okay, so here goes the xiphoid process. On the margins, it's connected to the costal cartilages. Here go the costal cartilages, okay? And sometimes you can also see the 11th and 12th rib behind where the diaphragm is attached. And posteriorly, I would say that the diaphragm is attached to the vertebrae, okay? Okay, now we can see here is a structure that is arising from the vertebral part of the diaphragm. And these are called the cruras, okay? So there, you can divide it into the left crus and the right crus. Usually you'll see that the left crus is shorter than the right crus. Also, the diaphragm is a muscle, so all the whole muscle of the diaphragm comes and attaches to a central part called the central tendon, which is the white part you see here. So let's label that. That is the central tendon. Okay? And also the diaphragm, I would say, has several openings, obviously for the structure to pass from the thoracic part of the body to the abdominal part of the body. So there are openings. There are three major openings, which is the aortic hiatus. Sorry, this is the aortic hiatus. And then this is the caval hiatus. And this is the esophageal hiatus. Okay, so first let's go to the caval hiatus. The caval hiatus is located at the level of the thoracic 8th vertebra is here. The main structure where it gets its name from is the vena cava that passes through this hiatus. The other one, as the name suggests, the esophagus passes through this, so it's called the esophageal hiatus. And it's at the level of T10. Okay. And the third hiatus that passes, and the third opening is known as the aortic hiatus. The aortic hiatus is at the level of the T12 vertebra, and the main structure that passes through it is the aorta. Okay, so here are some labels till now, but there are a few more labels we need to add to this picture, okay? So let's remove this for a bit so you can see the structure. So as we spoke about it before, this is a structure that arises from the vertebral part of the diaphragm, and it's called the crura. This is the left crus, and this is the right crus. So we would call this the left crus and the right crus. And as I mentioned before, the left crus is usually shorter than the right crus. Okay? And then, since there are more labels here. Okay, so there's something called the arcuate ligament in the diaphragm, which is labeled as, first, it's not seen in this picture, but I'll show you in the picture after this, that there's a lateral arcuate ligament. This is the medial arcuate ligament, and the one going around the aortic hiatus is the median arcuate ligament. So let's label that. Here would be the lateral arcuate ligament. Here is the medial arcuate ligament, and here is the median arcuate ligament. And on top of that would also go the aortic hiatus, the left crus would go here, and the right crus would go Okay, so these are some of the important structures, anatomical structures that you need to know for the exam for sure. Okay, so let me show you more pictures. So to make it more clear, here you can see a proper picture of the diaphragm with the structures, with some of the structures. Like here you can see the nerves, the phrenic nerves, and here you can see the arteries, here you see the xiphoid process, and here you see the aorta coming out through the aortic hiatus. And here are the cruces. Also, as I mentioned before, I told you that there are ligaments called the medial arcuate ligament, the lateral arcuate ligament, and the one above the aorta is the median arcuate ligament. Okay, so moving on. Yeah, here. So here, again, I want to repeat it since this is really important. The structure is passing through the hiatuses. Okay, so to be more specific, through the aortic hiatus passes the aorta, the azygous vein, the hemiazygous veins. Yeah, these are the most important structures that are passing through the aortic hiatus. And then, moving on to the next picture, is the esophageal hiatus. In the esophageal hiatus, which is located at the level of the T10 vertebra, here you will see the esophagus. You'll see the esophagus, and here you'll see esophageal arteries. Esophageal arteries passing through the sides. And if we go on to the next picture, here we see the inferior vena cava. Here you see the inferior vena cava passing through it. And here you will see the terminal parts of the phrenic nerve. Okay? Terminal parts of the phrenic nerve. And here you see nerves. Okay, so what nerves innervate the diaphragm? The nerves that are innervating the diaphragm are the phrenic nerves. And to make it easier for you guys to remember, you should know that the phrenic nerves arises from the C3, C4, and C5 vertebra. So to remember, you can say that C3, C4, C5 keep the diaphragm alive. So that's a really easy way to remember where the phrenic nerve comes from and what it innervates. Here you can see a picture of the diaphragm, which is labeled. So these are all the important labels that you need to know. Yep, and that's it. Thank you. I wish you guys good luck, and thank you for watching.